We started off today's session utilizing therapeutic ultrasound to help promote deep healing of the affected area. In addition, it helps with collagen synthesis. This is focused shockwave over the C6 to C7 levels bilaterally, where we suspect the lateral stenosis is coming from. This helps with angiogenesis. This is just some soft tissue work to help you get a little more loose for the next techniques. This is a little bit of a downward glide on the C7 to help free up that upper thoracic back. Then we moved into thoracic extension and rotation to help facilitate rib expansion and mobility of your mid-back. The next technique is myofascial decompression for the soft tissue of the affected area. It just helps with tissue extensibility while you move the cups on. Then we got into, I think, your favorite, supracipitable release, also known as traction, which should help take pressure off the base of your neck. And doing this just for a few minutes to get you prepared for your C7 down glide on the left. We used a grade 3, grade 4 joint mob repetitively until we got a nice cavitation, which alleviated some of her radiculopathy. This is mobilization with movement. I grabbed the transverse process of C1 and C2 and help facilitate rotation with my overhand to get into better movement patterns. Then we're doing ART, or active release technique of the scalene, where most of the peripheral nerve has been coming from in our neck. This can be done at home as well. Basic upper trap and levator scapulae stretches, just to help tissue length before we get into some strengthening as well. We use this next level device. It helps put the patient in a neutral position while pushing into a cervical retraction and rotation to help strengthen the multifidus and rotatories muscles that transverse the intervertebral foramen for stabilization. We then moved into seated self-mobilization techniques, into lateral side bending or lateral flexion. Stabilizing the segment below the affected area is what we're aiming for. We even went into extension, again, to help the bones move a little more appropriately. This is a snag technique where you can use an overforce around your head to get into the anterior tight cervical muscles. Next was strengthening, so using our serratus anterior and rhomboids to protract the scapula while you retract your head to engage the semispinalis cervicis muscles, longus colli and longus capitis. This is a trigger point for ART, just putting pressure on that painful spot, the levator scapulae, and then moving away from the device. Then we worked on strengthening your middle and lower traps, as those have been weak. The upper traps have constantly been tight. Finally, we finished up with some cervical retractions on the wall. It's a lot to go through, but keep up with it and reach out if you have any questions. Until next time, aloha.